This program is brought to you by Parkway Cancer Center. Cancer is fast becoming the leading cause of death worldwide, claiming millions of lives. In Singapore, cancer already ranks as the #1 killer disease, accounting for almost 30% of the deaths in 2009. Indeed, cancer is leaving a trail of shocking statistics that are sending shivers down many a spine. A cancer patient faces an uphill battle, fighting the dreaded disease as a lone warrior. An army of support from nurses, oncologists, surgeons, counselors, and more are required to match the might of an opponent as formidable as cancer. Helming this army of medical specialists are, of course, the oncologists, doctors specializing in cancer treatments who confront the full spectre of the deadly disease on a daily basis. Doctors like Khoo Kay Seong of the Parkway Cancer Center.
As an oncologist, I treat and look after cancer patients. In my specialty, the weapon that we use is chemotherapy and drug treatment. But we don't work alone. We work with a team of other doctors who play different roles in treating cancer patients. For example, surgeons, for example, radiation oncologists, they use surgery techniques and radiation techniques, which are all important tools in treating cancer patients. So as you can see, treating cancer is a team effort. It's multidisciplinary, requires expertise from different fields to come together to offer the best solution.
As for 64-year-old Tuti, chemotherapy was decided to be the only way to remove the tumor in her throat. But before treatment could begin, Tuti had to overcome her fears.
Permulaan gitu ya. Permulaan di tahun 2009 bulan Januari atau Februari saya udah merasakan kalau untuk menelan obat, menelan makanan atau minum saya sering kesendak, sering keselak gitu. Nah, terus nggak lancar untuk menelan, terus suara saya juga berubah jadi kayak parau, kayak orang sakit tenggorokan itu suka lain gitu suaranya. Nah, saya terus pergi ke dokter. Nanti dokter itu saya selalu dinyatakan seperti flu aja, kayak sakit flu tenggorokan, jadi yang suka banyak slam gitu. Saya selalu dikasih antibiotik, obatnya yang hampir sama semua dari beberapa dokter itu. Nah, terus saya bingung untuk mencari dokter mana yang saya harus cari gitu, yang untuk suara saya biar bisa bagus lagi dan bisa nelen dengan lancar.
Further tests in Indonesia suggested an abscess in her throat. But weeks of treatment there produced hardly any improvement. She finally sought help in Singapore.
I remember we started the first cycle of chemotherapy in the hospital.
After going through Tuti's past records, Dr. Khoo suspected the pain Tuti felt in her throat was more than a simple abscess. Dr. Khoo immediately sought the expertise of ear, nose and throat surgeon Dr. Tran. Dr. Tan's role was to look for visible clues on what might have been plaguing Tuti in her throat. A nasoendoscopy revealed a 5-centimeter tumor at the base of her tongue, which was already partially obstructing her throat and covering her voice box. It had been the tumor that was causing Tuti pain while swallowing and the change in her voice. A biopsy was then ordered to further analyze the tumor, but this would be a complicated procedure considering that the tumor was positioned at the back of the tongue. Any bleeding and swelling that occurred during the procedure would have resulted in blockage to Tuti's breathing and even death. In order to secure her breathing airways, Tuti had to first undergo a tracheostomy.
Inside, okay. We have to make a little cut on the skin in the front of the neck, get down to the windpipe and create a hole in the windpipe. And this hole then allows us to put in a tube, for example, in a little tube like this, where we put a little tube through into the windpipe to allow her to breathe. Once I did that, we could then bring her into the next phase, which at the same time, which is the general anesthetic. So she had a general anesthetic, she went off to sleep, and then I could go through the mouth and take a biopsy of a mass safely. And we went ahead and made the diagnosis for her. In this case, she came up with a diagnosis of what we call a lymphoma.
Lymphoma is the cancer of the lymphatic tissues, which are mostly located in the lymph nodes. It is said that lymphoma is probably the easiest cancer to cure due to its sensitivity to chemotherapy and radiotherapy. But that was hardly any consolation to Tuti, who was terrified of the very idea that she had cancer.
Saya di situ sangat-sangat kaget dan shock yang nggak bisa karena saya tahu itu penyakit yang sangat menakutkan dan yang susah disembuhkan. Saya sangat sedih, yang nggak bisa digambarkan lagi sedihnya, karena sangat-sangat takut gimana nanti hidup saya ini, sedangkan saya waktu ini
always a bit lower than the normal people. And this is okay. To most patients, cancer is cancer. All cancer are the same. To most patients, cancer equals to a death diagnosis. And it's not surprising because in their life, they must have come across family members, friends, colleagues, heard stories about how some patients suffered tremendously from cancer and eventually died of the cancer. But what people often do not realize is that not all cancers are the same. There are cancers that are deadly, and there are cancers that are highly curable.
Over in Vietnam, Tran Van Hoy was suffering from stage 2 rectal cancer. Although the cancer was still in its early stages, Tran was repeatedly turned away by doctors at home, leaving him deprived of treatment he desperately needed. Tran Van Hoy lives in Nha Trang, a resort town on the south-central coast of Vietnam, where his family owns a hotel. When Tran was diagnosed with cancer, his family was panic-stricken. They were desperate to find a cure for the family patriarch. But faced with rejection after rejection by local specialists, Tran and his family found their hopes diminishing as the days went by. The rectum is the lower part of the colon that connects the large bowel to the anus. Found mainly in people aged 50 and above, rectal cancer is the formation of cancerous cells in the tissue of the rectum. If detected early, rectal cancer is a highly treatable disease. But for Tran, his advanced age presented a setback to his chances of survival.
Đầu tiên thì thấy là trong người lúc nào nó đi xuống hậu môn nó cũng ra máu. Thì vào bệnh viện Chợ Rẫy thì ở Việt Nam là mổ đầu tiên là năm ngoái, gọi là 2009, thì thấy người nó khó chịu lắm. Cho nên là sang 2010 là con cho thằng Singapore mổ lần thứ 2. Thì cảm thấy là thằng Singapore mổ thì thấy là từ đấy giờ là nối được cái hậu môn xuống và không thấy ra máu nữa, và người thấy sức khỏe bình thường, và sức khỏe bình thường không sao cả. Bây giờ là không thể hy vọng ở Việt Nam chữa nữa. Đúng rồi, bác sĩ về sau có kết luận là tuổi đã cao rồi, cho nên là không xúc được cái chỗ dính như ở thành ruột này nữa, cho nên là chịu khâu vào để cho mấy cái xị trạ mấy cái cái liều thuốc kháng sinh liều cao, nhưng mà về tiêm trích thì cũng không thấy nó có kết quả gì cả.
After months of rejections from different doctors in Vietnam, Tran and his family finally decided to pack their bags for Singapore, confident that they would be able to find a solution there. The family headed directly to the Parkway Cancer Center at the Gleneagles Hospital, where they met cancer specialist Khoo Kay Seong.
And after that, we will, of course, we review the results.
Thấy là nghe thấy đài báo ti báo thì là nghe chơi họ sang Singapore là chữa chất lượng cao, cho nên là con cái đưa sang Singapore là chữa đợt thứ hai, lần thứ hai.
After preliminary examinations, Dr. Khoo and his team confirmed the presence of a tumor in Tran's rectum, despite treatments from his doctors in Vietnam.
He came with a history of having been diagnosed to have a cancer in the rectum. That was more than half a year ago before he came to see us. He had some local treatment. They have excised a polyp with a tumor in the rectum. It was told to be a cancer. But it was given minimal treatment. There was no formal resection of the colon done. He was given some chemotherapy, which are active, but I think it was not enough to treat the cancer completely. So when he came, he had some symptoms from the rectum. We did an assessment. The tumor was clearly there. It was fairly low down. Very close to the anus. We also tested and found that he has no spread of the cancer to any other parts of the body. So in other words, he had a relatively early staged, localized tumor of the rectum, but fairly low lying.
Time is crucial in the treatment of cancer. Unfortunately for cancer patients, time is also a luxury that they have little of. The time spent idling in search of a cure for his cancer was taking a toll on Tran, and his discomfort worsened each day. Having lived to the ripe old age of 80, Tran toyed with the thought of simply giving up.
Well, age is always an important factor when you can come up with a treatment plan. Because of his old age, he has an increased risk for complications. The risk can come from anesthesia, the general anesthesia. The risk can come from infection. The risk can come from whether he's able to breathe normally again after the anesthesia, and whether she's physically strong enough to recover from the surgery. There are also potentially cardiac problems that may be silent. So we have to optimize his condition before he goes for surgery. And in our best assessment, we felt that he was fit enough for the operation.
Unlike healthy cells, cancerous cells multiply rapidly and incessantly. Immediate treatment was the only way to prevent cancer from growing further and spreading. "80-year-old Tran had been suffering from rectal cancer for months. After numerous rejections by doctors in his home country, Vietnam, Tran and his family came to Singapore desperate for a cure. Once in Singapore, their oncologist Dr. Khoo had to look beyond standard courses of treatment precisely because of Tran's advanced age.
Now, the standard treatment for this cancer will be a resection of that part of the colon, the rectum, and we have to sacrifice the anus. We call it an abdominal perineal resection. What it means is that he will end up with a permanent colostomy, a created anus, so to speak, to allow the waste to be discharged into a bag, and that's permanent. When we discuss this option, it's clearly not an acceptable option to him.
Tran and his family were not too keen on such a surgery. They felt it would severely compromise the elderly man's quality of life. Even then, the family was intent on finding a permanent solution to end the torturous pain Tran was enduring on a daily basis. Apart from the cancer, Tran was actually in good health, with no signs of ailments typical of elderly patients like hypertension and diabetes. It was left to Dr. Koo to devise a treatment strategy that could cure Tran of cancer and at the same time preserve as much as possible his quality of life. One of the first steps was to assess the option of surgery. Dr. Koo called on colorectal surgeon Dr. Goh Hak-soo for expert analysis. Previous doctors Tran consulted felt that his tumor was inoperable. The doctors in Vietnam considered the tumor too large. Apart from its size, it also resided too deep down the colon. A detailed examination by Dr. Goh reversed all of the initial apprehensions.
Dr. Koo asked me to assess the patient to see whether this tumor is truly undissectable. So when I examined him carefully, I thought that the tumor was not that big because clinically it was mobile. So I thought it could be resected. So I told Dr. Koo, and Dr. Koo said, well, we could go ahead. So I operated on him and found that we can remove the cancer and took down his colostomy, joined him up, and then we were able to save his sphincter. He doesn't need to have a permanent colostomy. And very fortunately, the cancer turns out to be quite early. It was a stage 2 cancer.
Tran's surgery was a success. Today, not only is his cancer in remission, Tran is also back on his feet again. At the age of 84, Tran now spends his days enjoying the simpler pleasures of life. His son now takes charge of the business, leaving Tran to devote most of his time enjoying the company of family and friends.
He is an example of an elderly patient who was able to undergo surgery successfully. But the more important thing is this. You see, we have very close collaboration with Dr. Koo Kay-seong, who is an oncologist. Nowadays, the management of a patient with cancer is through a multidisciplinary approach.
Having been cancer-free for 3 years, Tran travels to Singapore every 4 months for a checkup with Dr. Koo.
So let's go for the blood test now.
Yes,
Meanwhile, at the early stages of treatment, Tuti was coping with her initial fears of chemotherapy.
Untuk pertama kali saya sangat-sangat takut untuk melakukan kemo karena bayangan saya orang di kemo seperti teman-teman saya yang sudah melakukan itu kan yang orangnya sering muntah, nggak stabil hidupnya, terus menjadi kurus dan berubah kulitnya yang menjadi hitam, rambut rontok jadi gundul, dan setiap makan nggak enak. Itu semua yang bayangan saya. Jadi saya waktu disuruh kemo, ya bayangan saya semuanya seperti itu. Jadi yang menakutkan semua.
We explained to Ibu Tuti and her family that lymphoma is a highly treatable condition. Even though it is malignant, even though it has an aggressive cause of disease, if it's not treated, they respond well to chemotherapy with the assurance that there's a very high chance the tumor will shrink and a very high chance that she can be cured. I think she was assured.
Because of the aggressive nature of her lymphoma, Tuti was put on an intensive chemotherapy regime. She had to bear with all the side effects and inconveniences that resulted. But with visible results of her tumor shrinking after only 2 cycles of chemotherapy, Tuti's morale was greatly boosted.
In Ibu Tuti's case, we devised a treatment protocol, which is primarily the use of chemotherapy plus an antibody called rituximab. With this combination of treatment, we expect the majority of the patients to respond very well to the treatment. And indeed, in Ibu Tuti's case, her response was marvelous. After two cycles of treatment, there was a significant reduction in the size of the tumor. At the end of the 4 cycles of treatment, we repeated a scan, and that scan shows that there was hardly any residual activity in the primary tumor site. We continued for another 2 cycles of treatment. When she completed 6 cycles, the repeat scan again showed that there was no evidence of tumor.
Tran's and Tuti's stories serve to highlight the many challenges patients and their doctors have to confront in the fight against cancer. It often is a protracted process that tests nerves and puts a heavy strain on a patient's emotions. As the Commander-in-Chief at the heart of this battle, an oncologist has the most arduous task of mustering the limits of his patient's will and determination, to have them stay the course with him until the very end, until victory is theirs to share. This program was brought to you by Parkway Cancer Center.